What would you do if there was a major medical emergency and you could not access professional medical assistance? If there was a grid down predicament or in the midst of disaster, you may not have access to that level of care. You may be faced with a situation which exceeds the capabilities of your first aid skill set. Today we're going to talk about what most consider the holy grail of survival medicine. This is the 4th edition of the Survival Medicine Handbook, and this one is in color. Let's get to it. So as some of you know, I have interviewed Dr. Joe and Amy Alton on the channel before, but I think we're in need of a refresher, so they're going to be coming back in the not so distant future to answer mine and your questions. So if you do have questions with respect to survival medicine after disaster and an emergency when help might not be accessible, then be sure to leave them in the comment section below and we'll use those for our interview. The kit shown in this video is the Bug Out Roll First Aid Medical Roll. For more information on this product, see the link in the description or an extensive breakdown video that we've done on it in the past. Now this is the 4th edition of their book. It's much bigger than the last edition, a lot more information. This is one of the most concise compendiums of survival medicine. If you only have one physical book in your collection, it should be this one because it's such an important book. I'm going to give you a quick breakdown of the book, but I'm not going to be able to do it justice in the 10 minutes that we have together today. But just to give you a sense of some of the things that they talk about, we'll go through some of the chapters. So the first chapter is on medical supplies. So they tell you how to build first aid kits. They provide you with various checklists that you can use to make your own what's called an IFAC or an individual first aid kit, a family kit, a vehicle emergency kit, you name it. Even if you want to build more advanced trauma bags, they have a lot of ideas in here. And even myself, who's done an extensive review of my own personal medical kit, there's a lot in here that I still don't have in my first aid kit to make it complete. The next chapter is on natural medicines. Not something I'm going to go into for obvious reasons with respect to the algorithm, but they provide some really interesting insights into that. They also talk about how to do a physical examination, which is going to be incredibly important if you have somebody who is sick. So they're talking about things like pulse rate, respiration rate, body temperature, all your vitals. And it should be known that this is a very well illustrated book. You can get either the color or the black and white versions. The color version is about twice the price. So the next chapter is hot and cold issues. So dealing with things like hypothermia, frostbite, altitude sickness. Then we have a chapter dedicated to natural disasters. So what would you do in a blizzard, a hurricane, dealing with waterborne illness and things of that nature. This next section is one that's popular with preppers, and that's the NBC, so nuclear, biological, radiological, and chemical. What to do if you're exposed to radiation and how to deal with nuclear fallout. Head issues, so this is a very extensive section that goes into acquired brain injury, eye infections, ear, nasal issues. And remember, this is for when there is no doctor available, right? So you are going to be faced with these afflictions after a crisis, and being able to deal with them is going to be very useful. Next is dental issues, so how to deal with abscessed tooths, how to extract a tooth, how to do pain management. I would advise all people, if you have a tooth that's been bugging you, get it out as soon as possible, because that's the last thing you want to have to deal with without modern medicine and localized anesthetics. Then there's a section on respiratory issues, so it's talking about things like lung disease, asthma, various infections, upper respiratory, lower respiratory infections, which is obviously very relevant right now. There's a section on heart issues, so how to deal with a heart attack, some information to supplement stuff you would learn in your first aid course about CPR. Next is a very broad section, and that's the abdominal issues section. So basically anything in the torso, they're talking about it in this chapter, whether it's kidney issues, food poisoning, intestinal tract infections, diarrhea, liver problems, things of that nature. Then we have urinary tract issues. The last thing you want to do is pass a stone after the grid goes down without any sort of anesthetic. That's going to be a real rough experience. In fact, it actually happened on an apocalyptic reality TV show. I can't remember what it was called, but a guy in the show on set had to pass a stone in a simulated post-apocalyptic environment. Not pretty. If I remember the name of the show, I'll get my communist cameraman to put it on the screen. So they also talk in this section about STDs. Without personal protective equipment, after the shizzy hits the fizzy, people are gonna be getting busy in the wrong kind of way. And that can lead to the spreading of a lot of bad stuff, especially when antibiotics might be in short supply. They also talk about bones and joints. Everybody's greatest fear, at least my greatest fear, after it happened, would be to get some kind of fracture or a complete break or a dislocation or something like that. So they tell you how to deal with those issues in this chapter. Very, very important. The next chapter is going to be skin issues. So that could be anything from rashes to blisters to various infections of the skin and how to deal with them. It's a very extensive chapter as well. Next chapter is animal stings. So bee stings, snake bites, even bites from larger animals, ones which could be potentially carrying diseases. The next chapter is extremely important, and that's allergies and anaphylaxis. If you don't happen to have access to one of these EpiPens, and if you know somebody who is deathly allergic to something, then you're gonna need remedies in order to deal with that as quickly as possible. And they can give you some ideas on what you can do when you can't get professional medical help. I need to emphasize the point too, guys, that this is only if you cannot get medical help. And I hate to beat that dead horse, but we're on YouTube and I need to provide as many disclaimers as possible so people understand that this is only after the apocalypse, okay? Anytime you can get medical help, you should get it before consulting with a book like this, always. Next section is very important, is burns. So 1st degree, 2nd degree, 3rd degree burns, how to treat those. Next section is very important because this could kill you very quickly, and that's bleeding issues. So how to use a tourniquet, how to stop bleeding, bleeding control techniques, using clotting agents, things like that. Next section, everybody's worst nightmare is major trauma. So how to deal with gunshot wounds, how to deal with rib fractures, how to do minor surgeries, dealing with stab wounds, using a chest seal, things like that. Next is going to be wound care, so how to use a suture set. I've done a video in the past on how to suture. There's suture training kits that you can get on Amazon. I'll post a link to those in the description. We've also demonstrated skin staplers on the channel before. And they also talk about ways to use local anesthetics and what you can use as a local anesthetic. That's one area where I think a lot of people would get a rude awakening, is the lack of painkillers after a grade down situation, and not having access to an anesthesiologist would be pretty nightmarish if we had to go back to how they did things in the Civil War. Mass casualty situations. So you may be in a situation where you have mass casualties and you have to triage people. You have to figure out who needs care first. This is going to explain that whole process to you. Very important. Patient transport, another important thing. If somebody is bleeding, or if they have fractured ribs, or if they have broken bones, then you need to know how to properly transport those people. This one is probably every man's nightmare, and I think probably every woman's nightmare also, is having to give birth without any professional assistance there. So they take you through that whole process as well. There was a scene in the movie The Road where they had to do that without any doctor. Now, people have done that for millions of years, but we're pretty pampered in our society, so it'd be a shock to a lot of people. Next is going to be chronic medical health conditions. So how to deal with things like heart disease, thyroid issues, hypertension, seizure disorders, diabetes. There is a short section on mental health. I don't think they go too much into psychosis, but they do talk about anxiety and depression. And lastly, they talk about medications, including antibiotics. They go into great detail about expiration dates and all the rest. So needless to say, guys, this is a book that has a place in every prepper's library. In fact, if I could only have one book, it would probably be this book. It's more of a reference guide, so it's probably not something you're gonna read through, but it's just good to have it somewhere. but you might want to go through it and flag the pages that you might think would be important to you. So you guys can get a signed version of this book. I believe they signed 500. I have about 30 of them for sale still. So if you want to get a signed version, go through the website. I can't guarantee that if you purchase one through the website, it's going to be signed because somebody might have got it before you. Honestly, for some people, that's not going to matter. But I'm sure if you ever bump into Dr. Joe and Amy, they go to a lot of prepper expos and stuff like that. I'm sure they'll gladly sign your book for you. And if you are interested in the first aid bug out roll, it's a great system because it allows you instant visual access to all of your medical supplies. And pretty much most medical stuff can fit in these pockets. There's large pockets as well. I just think it's a great strategy to have to deploy your kit in an instant. You can see everything right away when seconds count. We don't sell them as a complete kit. I would encourage you to build your own first aid kit from scratch. But if you need something in a pinch, you could always grab a pre-made kit like this one from Adventure Medical Kits. They come in a variety of different sizes. And don't forget, put that headlamp in your first aid kit, guys, because you want to have your hands free in an emergency if one happens at night. Let me know if you have any questions for Dr. Joe and Amy in the comment section below, and when I do interview them, we'll be sure to ask those questions to them. Thanks for watching. Canadian Prepper out.
The best way to support this channel is to support yourself by gearing up at CanadianPreparedness.com, where you'll find high-quality survival gear at the best prices, no junk, and no gimmicks. Use discount code PREPPINGGEAR for 10% off. Don't forget, the strong survive, but the prepared thrive. Stay safe.